Also today, fears are growing about a so-called tripledemic, with hospitals across the country filling up with flu, COVID, and RSV patients. The CDC says flu hospitalizations nearly doubled week over week. I'd now like to bring in ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, for more on this. Dr. Patel, what do you make of this new warning from health officials, and what should people do if they have the flu? I mean, when's the line for staying home versus going to the hospital?
Well, Trevor, simply put, what I make of this is that we are seeing a very bad flu season, as you indicated, potentially the worst we've seen in 10 years. And that just means that we're going to see an unfortunately large amount of hospitalizations and deaths, with the CDC reporting already now almost 80,000 hospitalizations. For the average person out there, it is important to understand that you are more likely going to have an outpatient or a mild case than needing to go to the emergency department. And emergency departments right now are overrun. So you don't want to go to the ER unless you truly do have an emergency. With influenza, that tends to look like something like respiratory distress, meaning you are really struggling to breathe, or you're dehydrated because you are unable to take in liquids. And in some cases, you have neurological symptoms such as confusion, disorientation, or actual seizures. In all other cases, you want to talk to an outpatient provider, maybe even something like telemedicine, and stay home until you are completely well so you do not further spread the flu.
Let's talk about COVID. I mean, I know a lot of people, the way that we're living can almost feel like it's in the rearview mirror, but at the same time, almost half of the United States are seeing higher COVID-19 risk levels, according to the CDC. That's a sentence that a year ago, 2 years ago, would have really rang some alarm bells. So what does this mean actually in terms of COVID spread?
Trevor, what it means is that we still have a COVID spread, and even though we want it to be in the rearview mirror, we can't ignore or normalize the fact that we still see 2,000 deaths a week, around 300 deaths a day. That is not something that we should normalize or ignore. So yes, we are seeing COVID spread right now throughout the country, possibly related to the weather, but also we can't ignore the fact that these Omicron subvariants, including BQ1 and 1.1, are now making up over half of cases right now. Now, that doesn't necessarily mean that we're seeing something like we saw with Delta or Omicron, but it's important to note that if you're high risk, someone who is immunocompromised, for example, this limits the effectivity of certain medications, with the FDA recently saying, hey, no more bebtelovimab. That was one medication, a monoclonal antibody, that is not effective against these new variants. But what does still work is Paxlovid, remdesivir, the bivalent booster, and all these other tools we have. So we know who is at risk, and we know what to do to keep people safe.
And real quick, doctor, I mean, when you have flu, you have COVID, you have RSV all going around at the same time, how can people actually tell the difference between them?
In many cases, you may not be able to. There's certain telltale signs. Influenza comes up really fast. RSV can cause wheezing in young kids. COVID-19, we all remember that loss of smell that can happen. But if you are high risk, if you have a young child, if you live with someone who's high risk, it's important to talk to an outpatient doctor or provider, potentially get tested, because that may drive your isolation period or give you any antivirals you may need. But in many cases, it might just look like a common cold. So be on the lookout.
Okay, very good to know. Dr. Alok Patel, thank you very much for your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.